Hi, my name is Gail Houseman. I'm a nurse with ALS United Mid-Atlantic, and I'm here to talk about advanced directives.
So advanced directives for people with ALS. So what is an advanced directive? An advanced directive is a written guide that identifies your future healthcare goals or wishes. It's a guide for healthcare providers, so your primary and your other docs and your loved ones, of what you want and what you don't want as far as your medical care. It is only a guide, and it's only to be followed by your loved ones if you're not able to communicate your wishes at the time that you have something go wrong. Okay? It does not need to be notarized in the states of Pennsylvania, New Jersey, and Delaware. And it includes having you identify a medical power of attorney, and we'll talk about that. So what is a medical power of attorney? A medical power of attorney is the person or persons that you identify or designate to make healthcare decisions on your behalf only if you are unable to communicate your wishes. Okay? It's important that your medical power of attorney agree to follow your healthcare wishes when you need him or her to do so. Other names for medical power of attorneys include healthcare agent, healthcare proxy, healthcare surrogate, and healthcare representative. Some people identify a primary medical power of attorney and a secondary medical power of attorney in case the primary medical power of attorney is not able or available to act on your behalf. And your medical power of attorney does not need to necessarily be your spouse if you feel like somebody else in your loved one group, your family, would be more likely to follow your wishes. So what's the difference between a living will and advanced directive? Very often these terms are used interchangeably, although there's just a slight difference. A living will is a document that addresses your health care wishes. A separate form that is included in the living will addresses your medical power of attorney. The two forms combined would be called an advanced directive. So what's the difference between a will and an advanced directive? So a will is a legal document that has to do with your money and your financial assets. Most people have their wills done by an attorney. An advanced directive only deals with your medical wishes, not your finances. You don't have to have your advanced directive done by an attorney. It's a simple form, and it doesn't need to be notarized. So what is a post form, and how does this differ from an advanced directive? A post form, or portable medical orders, is a form that is completed by your primary care provider, or it could be like a different doc, a neurologist, palliative care doc. But basically, the form is put in the electronic medical record. This way, other healthcare providers would be able to view your healthcare wishes, what you want. So some people will put in a full code. Other people will put in comfort care only. An advanced directive is a document that you would complete. A post form is completed by your PCP, which could be a physician, nurse practitioner, or a physician assistant. What are medical choices I might need to make because I have ALS? So a feeding tube, which we call a PEG, this would most likely be recommended if you are unable to chew or swallow safely. A ventilator. Most people with ALS develop respiratory muscle weakness that is initially treated with an external ventilator called a BiPAP or Trilogy. Some people with ALS choose to get a tracheostomy, which is a surgical hole in the throat, and invasive ventilation if and when the external ventilator, the BiPAP or Trilogy, is not effective enough to support their breathing muscles. So the feeding tube and what type of respiratory support would you want or would you consider are the two main issues that people have to decide on with this illness. Where can I get an advanced directive? Your ALS United social worker has them. You can just get one online. If you just Google advanced directives, there's tons of them. An advanced directive that I like is called 5 Wishes, and I have included the web address for that.
Thank you for viewing this presentation. If you have any questions, feel free to reach out to me